You have basically there's smooth muscles here that help with dilation and constriction. And so you have inflammatory problem, okay, and you have constriction problem. So you that is all your target. So you have inflammation and you get broncho constriction. That's all. So the second one, which is bronchoconstriction, in this case, we just want to open the lung, the air, the trachea and the bronchial. We want to open them up, right? So I told you about the B2 receptors. So you need a B2 agonist that will open the and the common one that we use is albuterol. Okay, this is the short-acting and beta agonist. They call it SABA. Basically, it's very quick. Act within 5 to 15 minutes, you're done. So because we are in emergency, we can't give you something that is long. So short-acting medication. So therefore, if it's a short-acting, it's a rescuer. That's why they call it rescue medication. Short-acting, it just rescue you from danger. You got to give them something that will rescue them from danger. So short-acting rescue medication. So that's what it does, right? Unfortunately, the beta agonists, it just basically, it does what it do. It go and bind to every beta receptor that is over there. That's why they have palpitation. So that is normal. Agitation, right? Or you can say tachycardia about that. That's normal for them. Don't worry. If they give you a patient who has albuterol and all of a sudden you seeing the patient and his heart rate is 110, you just wash your hands and say, I will see you back later. You'll be fine. That's normal. Tachycardia 110 after albuterol, you don't need to see that patient first. Patient has the tremor, okay, fine. The same thing. You stimulating the beta receptors. That's why they're doing that. If I'm stimulating you, think about it. People who take stimulants, what happened to them? Ephedrine and all those things, what happened? They can't sleep. Insomnia, you'll be like walking around all night and you can't sleep. Don't memorize these symptoms. Think about it. I'm stimulating you by the beta agonist. Yeah, you're not going to sleep. You'll be awake and pacing. You have a tremor, tachycardia, palpitation. They're all normal, right? Because of the stimulation of the beta receptors. Remember epinephrine. Let me take it there. Epi. Why do you have epi? When I give you epi, what happened to you? You have palpitation, tachycardia, you can have tremor, you can have insomnia. It's the same thing because they're stimulating the same receptors. And what else? These are stress hormones, epinephrine, okay? I'm trying to explain something to you. They are stress hormones. Stress hormones, what do? They increase your glucose. That's why. So that you can use it for energy. You know, you can run away from the snake. If you give somebody albuterol, the sugar goes up. Glucose goes up. And guess what? That's where they will trap you. A patient who has an asthma on albuterol and has diabetes, we got to modify their medication. These are clinical stuff. I want you guys to pay attention. That's how you think for your exams. Think clinically. You can't memorize everything, but think something that is relevant. Of course, do you think there's a bunch of patients who have asthma and they have diabetes? They have asthma, they have blood pressure problem. So you gotta like, oh, okay, clinical scenario. I got to know that. If I know that, because if they ask me, then I know it. I mean, it's like something you have to know. Then you connect it. Because he's going to increase your glucose. Therefore, if you have diabetes, I got to give you more medication. I got to make sure your metformin, I got to give you double dose so that because your sugar, it won't work. You see how you got to do that, right? And the last one is it causes hypokalemia. Most people don't know. So you got to be sharp about it. So is it? Hyper-K, the treatment is glucose, insulin, albuterol, K-acylate. I can spell it, whatever. Yeah. What is that? K-acylate. I can, yeah, something like that. And if it doesn't work, they get dialysis. That's the treatment of it. So, these are the signs and symptoms of that. So there's none of them will worry me than hypokalemia. So if they've given you somebody with asthma, you treated them, all of a sudden they have palpitation, they have tachycardia, don't worry about it. The glucose go up, fine. If they give you hypokalemia, yeah, I'm worried about that patient. Okay, so that's that one. It's a beta agonist rescuer, easy B. Short acting. His friend is Samithorol. That's long acting. That one, it take a while to. It take a while to work. So they all have the last name Raw. Raw, not Law. Law is a blocker. Raw is a agonist. Okay. So this one is a long acting. Therefore, if I come in and I'm in distress, don't give it to them. So this is for long-term control. That's all I want to say about it. Okay, because it takes time. It takes like 10 to 15 minutes to work, and it can last for like 12 hours. So you don't need that, right? Now, we're still working on a bronchodilation, okay? There's a medication that you can use it in OB also, okay? This is terbutaline, so don't forget it, connect them. It's also a bronchodilator. It comes in the oral form. This one is also long acting, so it's not a rescue, it's for maintenance, right? So the problem is all other medications treated for asthma, you got to know contraindication. That is the way I want you to guys to remember this respiratory. Apart from albuterol, the other medication are so bad that you have to know contraindication and the side effect. Terbutaline, what happened? It's bad. Okay, it has a black box on it. Okay, it causes problem. It also increases your sugar, so it causes you diabetes. I mean, it increases your glucose. That's all I want you to pay attention to. It can also causes dysarrhythmia. And you guys know my favorite, which is common. Okay, all the anticholinergics, they have the last name opium or tropium. When you see them, you may not know them, but I want you to pay attention to this last name, tropium. They can give you so many of them. All you should be looking for, if we give you any medication you don't know, you see tropium, is an anticholinergic. This anticholinergic medication. And you already know the side effects. You already know that, right? So this one can be used in acute phase because it can be used, it get dilated quickly. Okay. So sometimes they get that, they get albuterol. These are all inhalers, okay, not oral form. They can use for initial treatment to use as an inhaler. And the other one is it start with the T. I will write it so that you tiopium. Oh, they are all inhalers, and all it does is a bronchodilator. They dilate it, but they are anticholinergic. So you know the symptoms of anticholinergic. If I give this to you, well, you're going to have a dry mouth, right? Don't worry about it. But the patient needs to know that, right? They can't sweat, no sweat, right? They get constipated, right? urinary retention, right? This should be something like you just come like that, so that in case you see in the SATA form, you say, oh, I know. So you have to be careful about it. So urine output is going to decrease and they get into trouble. And a glycoman is going to worsen your glycoman. So when they give it to you, you paying attention. And then in the SATA form, you don't even have to worry about it. All these anticholinergic symptoms. So, oh, okay, dry mouth, no sweat, constriction, constipation, decreased urine output, and you take care. The opposite is cholinergic side effect. There's a question. Oh, okay. Right? And that's that one. Of course, there's the dangerous ones. Okay. Question, somebody have a question? We're still on this thing, the pharmacology for this. Remember, there's some, we don't use them often, but they're very important and I want you to know. We call them metaxanthins, okay? An example is theophylline. I know you guys know about it, theophylline. It's a good medication, but it has so many side effects. So many side effects with a narrow therapeutic is 10 to 20. All the medication with the narrow therapeutic, you can see they are within 10 to 20, like phenytoin and other ones, 10 to 20 range. It's powerful. I'll give you some trick to remember it. Theophylline is the 3 C's side effect. 3 C's. 3 C's because it caused so many problems. And so they don't even teach you about the side effect. They teach you what you should worry about. You should avoid to causes the side effect because the side effect is so bad. They get seizures. So you want to, it causes arrhythmia. So the main side effect is cardiac issue, arrhythmia, okay? And seizure. So you want to prevent that. Because of that, you tell the patient, teaching, this is your SATA question, teaching and education. If I put you on theophylline, I don't want you to get cardiac arrhythmia or seizure. But what do I tell you to do that? Is the 3 C's. No Starbucks. Okay, you can't go there. Any caffeinated drinks, no. Sorry, man. You can't do that. H2 blockers, no. Cementidine, especially. You can't take it. Okay? And the liver problem. So the last one is Cipro. You can't take ciprofloxacin. You can't take that. But they usually C4. The C4 is, I put the, after I do this and I had this last one, the C, is hepatic toxicity. So if you, because it doesn't, I can't put cirrhosis, you know. What this means is you should not take any medication that will affect your liver. Otherwise, it will increase because the medication is broken, will destroyed by the liver. And therefore, if you're taking a medication that is affecting your liver, then what is going to happen? You have toxicity of theophylline. And therefore, common one people take all the time is acetaminophen. You tell them don't take it because then that is going to affect the liver. Okay, so liver disease. If they have a liver disease, you can't get it. So you can do 4 C's or 3 C's. Cimetidine, caffeine, Cipro, antibiotic, and a cirrhosis. You can put cirrhosis, but most people don't have cirrhosis. You don't want to take anything that affect your liver. What else? The most common one is alcohol. So I have another way of remembering. Okay, you can do 3 C's and 2 A's. How about that? 3 C's and 2 A's. Acetaminophen and alcohol, you should avoid them because they affect your liver. And the 3 C's are what you have here. So 3 C's and 2 A's is what you should avoid when you see theophylline. Run away from it. No alcohol, no acetaminophen, no Cipro, no cimetidine, and no caffeine. okay? Because I don't want you to have arrhythmia or seizure. Now, so those are the, I don't think there's any more dilator. These are what dilating. So when they give you answer choice and you're looking, you can pick them, okay? Because they're doing what we expect them. Now, you got to deal with the inflammation. So pharmacology is all pathophysiology. That is the best way to learn it. You can't memorize it. Know the problem and say, oh, this medication is used for this. Put them in the system. So inflammation, steroids are the best inflammation drugs you can have. So they are anti-inflammatory. These will help with inflammation. So I'm not going to list them. There's a bunch of steroids, and the way you see them last name with son, okay? That's all cash sons. I mean, as soon as you see them, you know, they have these last names. There's a bunch of them. I'm not going to list them, but just look like the last name in the cell. These look like steroids. Son, Casson, Metason, you know, they always have that kind of last name. All they're doing is what? Taking care of the inflammation. But if I'm the examiner, I'm not going there. I'm trying to see if you really know your stuff. And when I give an asthma patient steroid, what do you think? I take you to endocrine. Here you go. And you have to figure out, hey, endocrine, why am I dealing with endocrine on an asthma patient? You see the question, you worry. It's like, why the teacher, they asking me about endocrine stuff? Yes, because when you put them on steroid, inhale steroid, some people have oral and inhale steroid. And get what? You make them cushingoid. Now they are cushingoid patient. It become a Cushing patient. And what features do they have? I don't even have to list it for you. You know that. Or the moon phase, hypertension. Okay, I'll do that. Hypertension. Okay, moon phase, right? Abdominal strain, right? Buffalo amp, you know. You just keep on, right? Asceticism, right? It's just like you don't have to memorize it, you know. You can just like figure it out, like, okay, yeah, overweight, obesity, you know, right? Fluid overloaded. You see what I'm doing? I don't have this written down. I'm just saying it in my head. Fluid overloaded, right? What? What else? Can think about like steroid, infection issue, right? Wound infection, right? You just keep on going and going. Glucose, you know, hyperglycemia, right? You keep on coming. All these things, you just osteoporosis. You see where we get into different things that, you know, is away. So that's how you study. So when you study, don't limit yourself. Okay, asthma is on steroid. Well, I kind of bring my endocrine that I know into the system, and then so that when they ask me, then you can teach them. Okay, don't stop taking your steroid. We got to taper you. Okay, because if I don't taper you, what happened? Adrenal crisis. Sorry, guys, we're doing endocrine right now. That's the way it goes. It's a system problem. Now they are in adrenal crisis, and you can know hypotensive. I'm not going to go there, but that's the way. Now they are in adrenal crisis or downhill. So they don't stop taking the steroid. They taper it slowly by the doctor direction. Think like that. Any question on that?